we got to put some new stuff up.
Almost 40 years of significant sports memorabilia tied to sports greats from around the world translates into a tireless enthusiasm for sports and caring for people.
Okay, let your hip real relax for me, real loose for me.
As an orthopedic surgeon, Dr. Larry Lemak's passion is tending to all of his patients alike, relieving pain, improving an injury to the knee or arm or shoulder, for example, and enabling patients to return to their normal routine. But like many of his patients, Dr. Lemak found himself sidelined. In October 2012, Lemak's life as a physician was put on hold, and his own health became first priority.
I had a chronic sore throat, and I was concerned about it, and they checked it and didn't think much was wrong, but it kept persisting, so I asked for further, evaluation.
The alarming diagnosis? Throat cancer, stage 3. Doctors found cancer at the base of his tongue, and it had spread. Dr. James Bonner, chairman of radiation oncology at UAB, was one of 3 specialists to oversee Lemak's care.
We staged the actual tumor by the size of the tumor, a 3-centimeter tumor in the base of tongue, and then a 1.4-centimeter tumor in the neck.
Dr. Lemak underwent intense radiation and chemotherapy for 2.5 months.
It is a very tough treatment because the radiation irritates the normal swallowing apparatus, and the patients will have pain with swallowing and difficulty really maintaining their nutritional status.
I really was at home for 2.5 months, really just going out to treatment and staying at home.
He says the end of radiation was the beginning of the worst week of treatment. Less than a month ago, Dr. Lemak was being fed by a tube.
Are you afraid to start eating?
Yes, very much so. It wasn't a month ago that I had to take narcotics to drink a cup of soup.
Dr. Bonner describes Lemak as the best patient. Lemak describes himself as a difficult one. He says without his wife's support, he could never have reached the finish line. Phone calls and other support also came from family, friends, and patients like boxer Roy Jones.
I said, Roy, going through this I told people it's like getting in a fight with you, and it was the 12th round the whole time, and you wouldn't knock me out, but you kept hitting me.
Dr. Lemak returned to work while still in the recovery phase. At this time, it's been just over 2 weeks.
But I'm glad to be back working and being able to see patients and treat patients. I think I've learned to be a better doctor, and I've tried to adjust things in my practice to do better. Even though I've always tried to be kind to people, you can do better.
Now, as a cancer survivor, Lemak's goal is to help spread throat cancer awareness.
What was different about that sore throat? I mean, that sore throat had to be different.
Nothing other than it persisted.
In Birmingham, Linda Mays, ABC 3340.
Find on exam that a doctor or a dentist will feel a nodule. And one of the things I learned is